Okay. So really quick, before we get into the skills, does anybody have any questions? Because I know, we're dealing with the video. So in person, I want to be able to see if I can clarify anything you may be thinking. Anybody? Okay. So for the most part, what we were dealing with the video is the core principles of what is CPR, when do you do it, why do you do it, and now we're dealing with how do you do it. Okay. So how do we do CPR? Okay. What is CPR? It's a verb. It's the action or process of pressing on the heart, flowing oxygenated blood to the brain. That's why we show this slide right here. Flowing oxygenated blood up these pipes, which we call carotid artery, right, to the brain to fill the brain up with oxygenated blood, obviously because that's what the brain needs in order to function, okay? So the heart isn't beating for itself, right? So we have to manually push on the heart so it can work and do what it normally does, which is circulate oxygen and blood. The lungs isn't bringing in oxygen for itself. So we're going to have to manually do that by blowing into the mouth. And the lungs mix oxygen with blood, and we flow oxygenated blood to the brain, okay? At the same time, the brain is what controls those two organs. So it starts and ends with the brain, right? So our objective is to cut the brain on, then the whole body will cut on. The reason why the whole body is cut off is because the brain is off. Okay, we'll just get that concept. Because it may be confusing when we start dealing with AED, right? AED is a problem with the rhythm of the heart. Defibrillator, dealing with fibrillation of the heart not beating normally, like arrhythmia. You ever heard of that, right? So the AED solves the problem with the heart, right? But CPR deals with the real core problem, which is the problem with what? The brain, okay? Right? You can have a heart transplant. You can have a blood transfusion. But the brain goes out, that's it. At this stage in modern technology, once you lose your brain, that's it, okay? So we're trying to, at all costs, to preserve the brain, okay? And how do we do the CPR, okay? So first we deal with 30 compressions, okay? What is a compression? Obviously, a compression is us compressing on the heart. So one of the main things that I emphasize outside of knowing when to do CPR, which is when you're dead, is where do you place your hands? Okay? You have a heart right here in the center of the chest. Okay? This is very, very important. Okay? Let me have everybody stand up. Okay? And before we get into these CPR skills, I want you to press on this bone. You feel that bone right there in the center? That's called your sternum bone. Okay, y'all feel that? Sternum? That's what we want to press on, right? In between the lungs is a heart just below that bone, right? We want to press on the heart, right? What will we press what good would it do us to press on the stomach? Would that do any good? Okay, no, because there's no heart there. Our objective is to press on the heart. So having the proper hand placement will make a lot of sense, right? So we got to be pressing at the right place. So let's all try to put our hands in the proper place, okay? Your dominant hand should go on the bottom. Okay? So that's good. Are you right-handed?
Yeah.
Okay, excellent. So that's your dominant hand. Good. Everybody put your hand on the bottom. Excellent. Okay? Now, this is an easy way that I'm starting to realize to teach this, right? So, now let me just go into detail. So at the base of the sternum, you have this little sharp object right here. It's called a xiphoid process, right? They kind of show it right here. Little sharp little part, right? Now, if you think about anatomy, below that sternum, you have something called the diaphragm, right? Which is what allows you to breathe. This is the muscle that allows your lungs to contract and relax, okay? So it's almost better to be pushing on the actual stomach itself than to be pushing just a little bit off at the base of the ribs, right? So what we want you to get in the habit of doing is, if you look at this rib cage right here and you see where it starts, make sure you're not on top of that, covering that up with your hand. Let's be above that to where you can see that. Because if you're covering up, then you can be pushing on it and you can break that off and puncture the diaphragm, and then it'll make matters worse, right? Now, keep this in mind as well. They're dead, right? Can you hurt somebody that's dead? Can you kill somebody that's dead? Okay. Can it get any worse than dead? No, it can't. They're dead. But, high level resuscitation teams are more effective than others, So if we know what we're doing, we'll be more effective in saving someone's life. So let's, pay attention. And this is a very, very key point that I emphasize, is the placement, right? Because I saw CPR being done on videos, on YouTube and things like that, and real life, not movies, and this is the common theme I see, we see it on the movies, and that's good, but when you're in the class and you're certified, then you got to get the proper education, and you need to leave with the core principles of what you need to know. And the two main principles I want you to know is, when do we do it? Where do we put our hands? Okay. So let's knowing what we just said, let's put our hands in the proper place. Okay. Good. Now remember this. We're not worried about our whole hand. Okay. We worried about the base of our palm right here, this little area. Why? Because when we push down, we want to make a straight line between our shoulders and that part, because we're going to use our body weight to push on them, okay? We're going to use our body weight to push down, all right? Okay, so put that part of the hand in the center of the chest, okay, on the sternum, okay? Let me see everybody. Good. See, y'all get it. Y'all got it. Okay? Now, just a few little fun facts. This right here, this white part, this is our cartilage, right? So this will break off, right? Because there's a heart under that. But that's what is supposed to happen, right? It's all made up for CPR, right? But now over here, these are just hard bone. And there's lungs under that, right? So we don't want to push over here. We'll puncture a lung if we do it like that, okay? It's made for here, but it's not made for here. It's not made for here. Okay, so the placement is very, very important, okay? And let's always take a photographic memory of where that hand placement is and always go back to that place, because you got it now, right? But when we get to going to doing breaths and coming back, then we may get misplaced, especially when it's a dead person in front of you. You're panicking. This is your first time, right? And, this ain't class. This is the real deal. You know what I'm saying? So just let's learn that mistake in here rather than, in the field, okay? So let's put our hands in the proper place. Put your other hand above it. Now, if you get tired or your hand starts to hurt, you can just put that hand like this. But for the most part, we want to try to interlock our fingers like that, and then lean forward, and let's push down and do some compressions. Let's go. Excellent. I need everybody pushing harder to where you can make that noise like I'm making. Good. Go at the proper speed. Okay, let me put on a little beat so we can get on the proper speed. So let's stay on beat. Come on. There you go. That's right. Everybody sounding good. Making music. Keep going. All the way down, all the way up. A little faster. Good, okay, good. Now what we want to do is this, right? We're going to do a solid 30, okay? Now we worked on our technique. If it's too a little hard for you because of your injury, then just take it easy. Whatever you can do without hurting yourself. But what we're going to do now is count 30 good compressions, okay? All the way down, all the way up. Our objective is to squeeze blood out of the heart, flowing into the brain. So we have to let the chest come back up to its normal position so the heart can fill back up with blood, okay? Ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, that's it. 30 compressions, all right? Everybody got that? Okay. But let's just do one more to just practice it, okay? So make sure you get that hand placement. Let's get that hand placement one more time. Okay, good. Lock him out. Lean forward. Count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Excellent. Okay. Now we're going to get into the breaths, okay? So with the breaths, what we want to do is, of course, get a first aid kit with a mouth-to-barrier device, okay? Our main objective with the breaths is to blow into the mouth, create a seal by pinching off the nose or covering it with a mask, open the airway, and see chest rise. If we see chest rise, we know that the oxygen has went into the lungs, okay? Now, it's going to be found in the first aid kit, so we're going to do compressions until this arrives, right? Because if you come on the scene, you may not have the first aid kit with you, right? But you'll have hands, right? So what we do is start compressions, tell somebody to go get the first aid kit, and you may be at 100 compressions before it arrives. But you don't stop compressions until this arrives. And when it arrives, then you implement the 30 and the 2. 30 compressions and 2 breaths. Okay? Now, when it comes to the breaths, ideally we want to have a mouth-to-barrier device, but there's different circumstances, right? You could be at home or whatever the case may be. But if you have a mouth-to-barrier device, right, and you're going to put the band around the head so it doesn't fall off, you're going to do a head tilt chin lift with a C-clamp technique, meaning you're going to press down around the nose area to create a seal so that oxygen doesn't come out the side of the mask, and you're going to lift the chin up, and you're going to blow like this. 1, 2, and right back into the compressions, okay? And we want to be seamless with it. Now, if you don't have one of these, you may have another type of first aid kit mouth-to-barrier device that goes into the nose and into the mouth, and you'll have to pinch the nose, and that's the method I want you to use today, okay? COVID and everything, we're not going to put our mouth on them. So what I want you to do is put your hands in the center of the chest, right? Then I want you to put 2 hands on the head, 1 hand on the forehead, pinching the nose, and then tilt the chin up like this. Okay? Good. Now these, with that hand. With the other one on the chin right here. See? Okay, let's lift it up like this. You see it lift up? Okay, good. Open the airway, because if I blow in it, the airway is down, the oxygen could go to the stomach. The stomach doesn't mix oxygen with blood, does it? Right? So we got to lift the airway, open the airway, okay? And then we're just going to pretend, okay? We're going to go like this. 1, watch your chest rise. 2, watch your chest rise. Hands back in the center of the chest. Okay? All right, let's do that again. Head tilt, chin lift. 1, 2, hands back in the center of the chest. Excellent. Okay, just pretend, okay? All right. Y'all got it? Okay, let's put it all together now, okay? We're going to do 30 compressions and 2 breaths. And what I want you to do is practice your technique. Try to see how you can get better on making longer compressions, coming all the way up, pushing hard enough and fast enough, quality over quantity. We want to do effective breaths and come back. Make sure you look at the chest to see the chest rise. That's ultimately how you can determine if your breaths are effective, okay? This is the only time we're going to get this. Next time, it may be the real thing, okay? Let's take it seriously, okay? Hands in the center of the chest. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift. 1, 2, right back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 23, 24, 5, 26, 27, 28, 29, 30. 1, 2, last one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2. Good job. Give yourselves a round of applause. You just did 5 sets of CPR. 5 sets of 30 compressions and 2 breaths. That's what it's going to take, right? 5 sets is the equivalent to 2 minutes of CPR. Okay? 2 minutes is what we are required to be able to do before switching off to the next person if we have some help. Okay, so let's say, for instance, this happens at your job of some nature, and you have other coworkers. If you're certified, then they should all be certified. They should also know where the first aid kit is as well. So we all have to chip in, put our hands on the plow, so to speak, help out with the CPR. You do your 2 minutes, you do your 2 minutes, you do your 2 minutes, you do your 2 minutes. That's 8 minutes. I do my 2 minutes. Okay, 10 minutes later, right, the ambulance is showing up. Now, we did what we were supposed to do. We gave high quality CPR without us getting tired, and that level of, blood flow to the brain didn't decrease. Okay, because we don't want it to decrease because we got tired. You know what I'm saying? We don't want somebody to die because we got tired, because it was all on one person. They were the only one who could have did it. You know what I'm saying? So just keep that in mind. Okay. All right. So 30 compressions, 2 breaths. That's what it's all about. And it's not hard. 2 hands for adult, 1 hand for a child, 2 fingers or 2 thumbs for the 2 thumbs encircling technique for an infant. Infant is under 1. Child is approximately from 1 to, I'll say, 12, right? 13 and up, we treat that as an adult, okay? But it's very subjective based on the size of the victim, size of the child, because a 12-year-old is a big difference from a 3-year-old, right? Okay, so keep that in mind. Okay, so now we're going to deal with what's called the initial assessment, okay? Initial, meaning the first, right? Just like the first responder, right? And the assessment, meaning you're going to assess the situation to determine what you should do, okay? So this is a big part of assessing the situation, okay? Because you being able to determine if you should do CPR while the 911 is on their way or not is going to be a big factor in, 1, saving of the life, and 2, what you're just going to be doing, and maybe of first aid, because Maybe they might need CPR, may not need CPR. Maybe they need some other type of help, okay? And us determining that is going to tell a lot. Now, the first step, though, is what? Does anybody know? The very first step before getting into the skills?
Making sure it's safe.
Make sure it's safe, right. Making sure it's safe. We don't want to just jump into the CPR when they just got electrocuted, right? We don't want to just jump in and try to save somebody in a big car accident and then the car blow up on us, right? We don't want to just, they just got bit by a snake. Now that snake is ready to bite somebody else. So first we have to just assess the situation. You see somebody laying on the ground, right? They could be dead, right? But the little hairs in the back of your neck and your goosebumps should start tingling, your spidey sense, right? You should be starting to sense what's going on in the environment that allowed them to be in that condition, okay? And after you have determined that it is safe by looking around, assessing the situation, then you can move forward, okay? Because we don't want to get started and then we determine it's not safe. Now we have to stop. We'd rather you make the scene safe, right, first, then get started. You see what I'm saying? Because you could harm yourself because it wasn't safe in the first place, and then we're not effective doing CPR as well. So that's two negatives, right? So first we're going to look around, assess the situation, make sure it's safe. There's a ton of different scenarios, right? Then after that, we're going to go into the determining if they're dead or not and what they're needing, right? Pretty much checking the heart, lungs, and brain. First thing we want to check is the brain. How do we check the brain? Anybody? Tap them on the shoulder. Just tap them. You see somebody laying on the ground looking dead, we don't just go into invasive look, listen, and feel, touching on them. We just want to I guess we are touching on them. We just want to just give them a tap. Hey. Are you okay? What's going on, right? They laying on the hallway floor. They laying on the bathroom floor. They laying in the street, on the sidewalk. We just tap them. I've been in multiple situations where because I'm CPR certified and I've come up on people just laying out, not knowing if they're dead, I go up to them, are you okay? They wake up. And I'm like, part of me is like, get out of the street, man. You know what I'm saying? But then it's like, okay, at least I know you're alive. All right. But if they don't respond, I know, the least I can do is call 911. The least I can do, right? It's not hard, 911. Even if you have something to do, call 911 and leave. But the least you can do is 911 if they don't respond. Now, if they don't have no pulse and breathing, technically, we should be doing CPR until they arrive. But let me clarify that. That's at our job. In the streets, you're not required to do anything. Now, if your job requires you to be CPR certified, then you are required to do CPR for your job if it's necessary. They're counting on you, right? You're caregiving. You're giving care to the child care, health care, right? You're dealing with the public and you're in the capacity of giving care, so we're expecting you to step up, okay? The streets, that's different. That's a Good Samaritan type thing. And you'll be covered by the Good Samaritan law, whatever you do, right? But in your job, you are kind of expected to do something about it, okay? And that's why we're getting certified for the most part, our job. So when we go like this and they don't respond, let's move on to the next step. Look, listen, and feel, okay? All right? I know this in Spanish. Mira, escucha, siente, right? So look, listen, and feel, and we take two fingers, right? Before putting it on them, I want us to put it on ourselves. This is your trachea, right? This is your jawbone. Put two fingers right in here and feel for a heartbeat. You feel it? On yourself. Do it on yourself. Right here, right here. Go to the side right here. Okay? You want to monitor that beat on a regular basis. Okay? It should be between 60 and 100 beats per minute. Okay? You want to know how to check it? This is what you do. You look at your watch, right? You feel for your heartbeat. And you count the beats. Okay? When I say start, I want you to start counting. Okay? Ready? Make sure you continue to breathe. Start. Stop. All right. So whatever number you got, multiply that times 4, because I just looked at this for 15 seconds, right? You kind of want it to be down to 1 per second. You know, if it's a little higher than that, we need to do some things weight-wise, diet-wise, fast food, getting it out of our system-wise, right, to lower that. And I'm talking to myself, right? I just had some in and out today. I don't know why I did it, you know. So I'm in a rut. Ever since that Labor Day and that brisket, man. Haven't been able to get out of it, man. You know, man. So your heart's supposed to beat between 60 to 100 beats per minute. Just want to put that out there. So check your pulse on a regular basis. The lower your pulse, the longer you live. The higher pulse, it will shorten your life, okay? Bottom line, that's what the numbers say. Okay, we can have accidents and things can happen, COVID and all that.
So it means 60 to 100 is normal?
That's normal, but it's better to be closer to 60, right? Okay? All right, so with all that being said, we're checking for a pulse, listening for breathing, listening for oxygen, watching the rise and fall of the chest like this. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Let's all do that. 2 fingers on the side closest to you, right? No, the other closest to you. With the hand that's closest to the head, take your ear, put it over the nose and mouth. Look at the chest. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Okay? Look, listen, and feel. What am I looking at? Rise and fall of the chest. What am I listening and feeling for? Breathing, right? And what am I feeling on the neck for? Pulse, heartbeat. That's showing the beat of blood going to the brain. Okay? If you don't have a heartbeat, can your brain work? No. Blood is bringing oxygen to your brain. If you don't have that, you're dead. That's like saying this TV gonna work without being plugged in. It don't work like that, right? If you're not breathing, can you live? No. Your brain needs oxygen to function so it can send signals down the spine for the different parts of the body to function through the nervous system, right? Like you said, the brain cells, right? So with that being said, if you have no breathing and you have no heartbeat, you are dead, okay? Nothing's going to bring you back to life at this moment except CPR. Guaranteed, if we leave you alone, you're going to remain in the condition you're in right now, okay? So we can be lifesavers. Or we can be revivers, right? We can revive them. We can resuscitate them, okay? Resurrect them. You know, if you want to look at it like that, like Jesus, right? Right? But just keep in mind, if you don't get started in that 10-minute window, you know, it's going to be too late, okay? So if they've been dead for like 24 hours, you know, it's no point. It's already done, right? I would say whatever you are thinking about somebody being dead, think about it times 2 when you're dealing with children, all right? Because children, their brain hasn't all the way developed. So never assume dealing with a child. Just go ahead and do the CPR, okay? This doesn't apply as much to children as it would adult, but the average is, say, 10, but we're adults for, what, 15 to 90, 100, right? So it's skewed towards adults anyway. Every second we don't do CPR or we haven't got started, there was an increasing level of brain damage, similar to what's happening when somebody has a stroke. Keep that in mind. Okay? So they're dead, right? So the next thing we need to do is this. Yell for help. Help! Somebody help! Help! Say that. Help! Okay? Right? And you want to delegate responsibility, take control of the situation. You, say that. You. Call 911. Call 911. 911. Llame 911, right? So this is the thing, right? We don't want everybody calling 911. This is a very important aspect of this whole process, right? If you say the wrong thing on 911, they'll send the police and they won't send the ambulance, right? Police, they ready to tape it off. It's a crime scene, they ready for everybody to die, bring the coroner. I'm not even lying, That's just, they want to get home, right? And they're more so aspect dealing with safety, right? So EMTs and paramedics don't have guns. So if they get wind of it being a dangerous situation, then that's why you get the situation where, they didn't come for 20, 30 minutes. You know what I'm saying? And they could have came faster had we said the right thing rather than the wrong thing. But if it was a dangerous situation, no matter how right or wrong it is, they don't have guns. So it might be a better idea for you just to transport them yourself in most situations. Understanding how to do first aid practices. They got this thing called an Israeli bandage. I live in a neighborhood where there's a lot of shooting. You might have to pack that wound like we learned on the bleeding section and transport them yourself. You call the police, they're not coming. It's dangerous, in different situations like that. Also, it may be a building with multiple levels and rooms and things like that. When they say they give you the address, then how can they find exactly where you are at that address? We need somebody who's dealing with the 911 to go be in communication with them, guide them all the way to you so they can take over. You see what I'm saying? That 911 call is very important. They'll have questions to ask the person doing CPR, right? That's a very important aspect. Let's not fumble that part. Don't just say, everybody call 911 and then just leave it alone. And then, we don't know who called 911. We hope 911 is coming. We don't see nobody actively talking to 911. It was somebody in the back room, and then everybody else couldn't get through because it was like the radio station. It was busy. Everybody calling 911. Sometimes my cousin is a paramedic. Multiple ambulance show up because everybody calling 911. And then it could have been another situation where somebody could have been saved. Okay, so you want to say say that you call 911. Make sure that's the right person to get the job done. Okay, now right, get the first aid kit. Say that you get the first aid kit. Right? What does the first aid kit have? The mouth to barrier device. Okay, we're not walking around with it, but we all should know where it is if we're all certified. And our job should definitely have one if they're requiring us to get CPR certified so that we can do CPR safely, okay? So let's get our first aid kit. Let's get our mouth to barrier device and check that out at your job, making sure they have one. You got a question?
They give you a first aid kit. It's this big.
Mm-hmm.
Do those little kits have something like that?
Check it out. If it don't, then tell them to see me. We'll get them one of these. Exactly. We got these right here. Okay, check it out. If you don't, we got these for you, for sale, $16. Okay, you can get one of these. All right, now, that's all we got to say. And then we're going to get started with CPR. You're going to say, I'm going to do CPR, okay? So just repeat after me. This is that initial assessment. The scene is safe. Say that. The scene is safe. Okay, and then tap them on the shoulder. Hey, are you okay? Okay, put two fingers on the side of the neck closest to you. Put your ear over the nose and mouth and look at the chest and say 1,000, 2,000, 3,000, 4,000, 5,000. Okay, it takes a little more than just a second to check pulse, right? You can't just be like, did I feel a pulse when I did that? No, it takes a little time to check that, right? So we want to be sure about what we're about to do next. We don't need to be pushing on the heart, breaking cartilage off from the sternum for somebody who is technically alive, right? People in diabetic coma, they look dead, right? You suffering from low blood sugar because you're on that medication, metformin, and you didn't get your sugar level raised up, you'll pass out and you'll look dead, right? But you're not dead, right? You do not need CPR. Now we get to pushing on the chest and all of that because we didn't know what we was doing. We didn't check those two things. Now we will be held liable, especially if it's at our job. In the street, you may be able to get away with it because of the Good Samaritan law. At your job, you're supposed to be dealing with insurance. You know, somebody gonna get sued, right? Because we all got money, right? No, I know I don't shoot. So with that being said, let's just make sure we know what we're doing as far as that. Let's take it from the top. Seen is safe. Hey, are you okay? Okay, 2 fingers on the side of the neck. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Help. You. Call 911. You. Say you. Get the first aid kit. I'm going to do CPR. Okay, let's do it again. Seen is safe. Hey, are you okay? 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. Help. You. Call 911. You. Get the first aid kit. I'm going to do CPR. Okay? All right. You guys got it? Okay, let me have y'all take a crack at it by yourself. Okay? All right, this is going to be your skills test. Okay? No, you know what? Let me just have you do it. I'm going to do hand signals. Okay? I want you to verbalize it. Okay? Ready? 3, 2, 1, go. But do the hand. Do. Okay.
1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. You.
Help.
You. I'm gonna do CPR.
Okay, excellent. Looks like y'all ready, okay? So this is going to be your skills test. Let me see everybody do it 100% from start to finish, okay? All right, in 3, 2, 1, go.
You okay?
Help. You.
Okay, let me see you do 30 and 2. 30 compressions and 2 breaths. Ready? Put 2 hands, manos aquí. 30 compressions, 2 breaths. In that right placement, let's go. 1, 2, 3, 4. Good form. 8, 9. Count out loud. I'm not going to count for you. Hit your chin lift. 1 and 2. Good. Excellent. Give yourself a round of applause. That was, you guys passed adult CPR, okay? Now, everything from here on forward is going to be the same technique, right? The same theory, but it's going to be a little different, okay? Because you're dealing with smaller people, right? Now we're going to deal with child, okay? But before we get into the child aspect, we first want to deal with choking. Well, actually, we're dealing with child for choking, right? So when dealing with choking, okay, remember how we talked about the diaphragm muscles, okay? So we all have that right here. Everybody feel this, your navel, feel your navel, and then go right above that, okay? Now what we want to do technically is put our offhand, meaning you write with your right hand, that's your strong hand. Put your offhand here because you want your strong hand to be helping you to thrust in. You see what I'm saying? So you want your hand with the thumb on the inside above the navel, right in here, pulling in, twisting up, trying to get to these diaphragm muscles, right, to get the air to flow out the airway, okay? So let's all just kind of do a quick demonstration, okay? You guys feel that a little bit? You feel that? That's what you're looking for in somebody else. You're not going to push too hard on yourself, but you got to do it hard, almost like hurting somebody. Quick jerking motion if you want to get it out, okay? You want to get the food out the airway to clear that airway, okay? Now, what I want you to do is stand this mannequin up, okay? And I want you to tap him on the shoulder and say, "Are you choking?" Okay? So, look, first off, when you're dealing with children, it's going to be more typical that they have a breathing emergency. The main things you worry about with children, breathing emergencies like asthma, choking, seizure, choking on tongue, and allergic reaction to different foods like peanuts and shellfish, right? Bleeding as well, because they can do stuff, cut their cells and things like that. Poison control, did I say that? Poison control as well, right? I'm gonna put the poison control number on there, right? Also, what I want to say is, but it's the same idea for adult and child, because we didn't go over it for adult. They're holding their neck, doing the universal choking sign, right? Probably had just got through eating, and they can't make any noise. No sound can come out because they are having a complete blockage in the airway, okay? So when you ask them, are you choking, and no sound comes out, they're choking. They're for real choking, right? They're turning blue. They're turning red. This isn't water went down the wrong pipe, right? Understand the difference. They're coughing, making noise. That's like, oh, they may have choked on a corn chip, It went down the wrong pipe. Pat them on the back. Get some water, okay? But don't make any noise. They look like they're about to explode. This is a life or death emergency. People die from choking all the time, okay? So what we want to do is, like you said before, our offhand is going to be the hand that's going into the abdomen, right? So we want to after we get consent, we have to say, can I help you? Say, can I help you? For adult, right? Child, it's implied, right? Stand behind them. You're going to put one leg in between their legs, making a firm foundation, one with one leg back. You're going to extend the leg that's forward, extend that arm forward, and you're going to wrap it around above the navel, right? And make a fist right around here, okay? And then you're going to get your dominant hand and come around, and you're going to use that to pull in and thrust up as hard as you possibly can, almost as if you're trying to pick them up, okay? And you're going to do it as many times as you possibly can until one, they pass out, or two, the food comes flying out their mouth, okay? And it's happened multiple occasions, especially if it's a complete blockage, all right? So, all right, unfortunately, we have to go over the worst case scenario. So let's just say, for instance, it didn't fly out. We're going to lay them down gently on the floor, okay? We know the brain is shut off because it wasn't getting oxygen, right? And there were no breathing, so the brain has shut off everything in their body. So what is it time to do? CPR, right? So let's just say, for instance, this is a child. We're going to use one hand, okay? For depending on the size of the child, depending on your experience level, but let's just go over it. Instead of using two, you're going to use that same dominant hand that was on the bottom, and you want to reinforce that hand just like this, okay? And don't press as hard as you would for an adult, but let's be consistent with the compressions, okay? And let's do 30. Ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good. 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After doing 30 compressions, we're then going to not do breaths immediately. First, we have to open the airway and look for the food, okay? So let me show you something real quick. When we press on the heart, we flow blood to the brain, right? But there's lungs also around that heart. So anytime you do CPR, you'll feel a little bit of oxygen coming out the mouth, right? So since we're pressing on lungs as well, then we're doing two things at once. We're also flowing oxygen out of the airway. So we're subsiding the food that was in the airway at the same time as we're assessing or treating the brain with oxygenated blood. So now, before giving breaths, we first want to do a finger sweep, okay? So you take your finger, and if you see food, don't want to do a blind finger sweep, obviously. If you see food, you want to go all the way into the cheek, sweeping from cheek to cheek and scooping the food out. So we're just going to pretend, do a scoop from side to side, scoop it out. Okay, now after that, once you see that the airway has been cleared, you're going to do breaths, right? Head tilt, chin lift, blow, 1 and 2. Now, if I see chest rise, I know the airway is cleared now. Now I know the blockage that was stopping them from getting oxygen to their brain is cleared now. So now I continue CPR until we get this brain cut back on, okay? Keep in mind, if this is a child, you have a high probability of being able to do this if you do effective CPR. Because remember, their brain isn't all the way developed, right? And so it's not going to be the same as an adult, like a 60-year-old, right? As a 8-year-old. It's not going to be the same. They have a higher probability of coming back, okay? So let's do 30 more compressions. Ready? And let's go. 1, 2, 3, 4. Count loud. Excellent, excellent, excellent. Okay. So the main understanding that we want you to understand when dealing with children, right, is don't give up, never. And just keep in mind that for the most part, it's going to be a breathing emergency, if anything. Choking is main concern. One hand when we're dealing with CPR on children where they're not too big and we're strong enough to do it like that, because we don't want to push too hard like we would on a big grown man on a little 5-year-old. Okay, it's a big difference. Okay, all right. So at this point, we're going to get into the infants. Okay. All right. So what I want you to do at this moment is have a seat. Okay, now, the main understanding we want to know with everybody, CPR and first aid, is being safe and preventing the problem from happening in the first place, right? Now, I'm totally kind of paranoid because I have a 1-year-old at this moment. And we didn't have multiple scares, almost inevitable. I feel like something is going to happen. You know, one way or another, it's like I can't watch everything. But what I can do is childproof the house. I can, put things on the stairs. I can, try to make sure there's nothing on the floor that they can put in their mouth. Do whatever I can to be as safe as possible. But at the end of the day, you know what they're trying to do. They want to pick up whatever it is and they want to put it in their mouth, right? It could be something dangerous like a screw. It could be something like a crayon. Man, 2 days ago, last night, my son, the 1-year-old, he took a bite out of some deodorant. I'm like, oh my God, you know what I'm saying? He's playing in the room with his brother, took a bite out of some deodorant. So I called poison control. It was aluminum zirconium. They told me they were, and the poison control number, by the way, 1-800-222-1222. I don't have any markers right now, so if you could just write that down, is 1-800-222-1222. That's poison control. Called them up, picked right up. They told me it's just more so of an irritant. But if it gets into their airway and they breathe it in, it could become a problem. You have to bring them to the emergency room. I immediately rinsed his mouth out, and he didn't take a big bite out of it, but I did see some teeth marks in it. So, and I saw it in his mouth. So I rinsed his mouth out. We kind of like cleaned his teeth, make sure it wasn't just on his teeth still, and we got him put his bottle back in his mouth, and we just kind of just was distraught. But just last night, even me being a CPR instructor, here we go. I'm in the middle of it. So I'm just letting you know, like, being safe is a good thing. But even when you're safe, things can happen. Okay. So, of course, dealing with choking with the infant is going to be very important. But first, we will deal with the back slaps and the chest thrust, okay? So this is how you do it. You hold the baby face out, right? And then you're going to put your arm through their legs and open the airway. And you may have to back away from the table and put them over your knee. Okay, so you may have to turn to the side a little bit. Now what we want to do is 5 back slaps and 5 chest thrusts. Okay, right here, now your lungs go all the way to your back, so in the middle of the shoulder blades, we're pushing like trying to knock the wind out of them so that that food comes out. 1, 2, 3, 4, 5, okay? Good. Turn them over. Once again, you may think that you're hurting them. That's fine, but you're saving their life as well, okay? Let's keep that in mind. You might have to hurt your baby to save their life, to get that food out, okay? I understand you don't want to hurt the baby, but hey, you know, we got to hurt them to save them, okay? That's what everything. And it could be, we don't want to push on somebody's chest. Hey, you got to hurt them to save them, okay? Now we get 2 fingers put in the center of the chest like this. 5 chest thrusts. 1, 2, 3, 4, 5. Constantly checking the mouth for anything that could be coming out. If we see some, finger sweep, okay? If you see something in the back and you can't get it with your finger because their mouth in the area is very small, then let's turn them back over. More back slaps. Ready? And let's go. 1, 2, 3, 4, 5. Okay, good. Excellent. Let's turn them back over. 5 chest thrusts. 1, 2, 3, 4, 5. Okay, that's baby choking. Okay, so they put something in their mouth, you need to get it out. That's the method we're going to use. Now, if we can't clear the airway and somehow the baby passes out, now it's time to do CPR, okay? Now remember, we do CPR when the victim becomes unresponsive. So if the victim is still responding, moving around, looking and things like that, we do this. We do something different. We don't do CPR until the baby passes out and the brain is shut off, okay? Because now we got to save that brain with oxygenated blood, okay? Now, let's put the baby on the table like this. And there's 2 new ways we can do the CPR, okay? One thing is this, though, just to keep in mind. Everybody stand up. The babies are very sensitive on their feet. So instead of tapping them on their shoulder, we tap them on their feet because maybe you walked in and the baby was unresponsive. You didn't see that they ingested something, right? Tap them on their feet. Another thing we want to do is check the brachial pulse, right? On the inner arm, there's a vein called the brachial artery, and that's how we want to check pulse on baby because they could be, they don't have much of a neck, right? So we can't put it on their neck like that. We check the brachial pulse on the inner arm, okay? Now the 2 ways that the new 2021 technique of doing CPR is the 2 thumbs encircling technique like this, right? For you ladies that have the nails and everything, you want to break anything. Or you can do 2 fingers like this. And that's crazy. I've never had a lady break a nail in this class. Never. I've been teaching her 8 years. And I didn't have some ladies come in some nails, right? No, but never. They know how to do it right here. Okay, so let's do 30 compressions, okay? Ready? I'm going to do this method. Ready, and let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 26, 27, 28, 29, 30. Okay. When you get it to the breaths, they have mouth to barrier devices, baby size. Okay. But for the sake of arguments in this particular situation, we're going to pretend once again, you know, COVID and everything. When you deal with the breaths on infant, you cover the nose and mouth with your mouth. And you do 2 short puffs just until you see chest rise. So no pinching of the nose for infant. Okay? Head tilt, chin lift with 2 hands, right? It's very delicate and sensitive. You want to rock it all the way up. You kind of just want to open it right in the middle. And then you're going to do 2 puffs like this. 1 and 2. Okay? Just make sure you make a connection around their mouth, sealing the nose with your mouth or covering it up all together. Okay? And let's get back into the breaths. Ready? And let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 6, 27, 28, 29, 30. Always keeping in mind, if this was a choking incident, we want to be checking that airway. See if some of that food came out. If you see something, finger sweep and get into those breaths. 1 and 2. If you see that chest rise, you know the airway is clear. Okay, so that means we got to get this brain come on. You should be successful, okay? But it's a big responsibility. If something happened, it's all your fault. Bottom line, this is your child. You should love them enough to make sure they stay alive until they get a little older. Now, a couple things. A lot of times, it's hard to find a babysitter. I know that myself, right? So you may be the only one watching this child, right? So you got to keep your phone charged up, and it has to be on you. Right? If it's not on you at the time, you may have to pick the baby up, right? Go pick the baby up. Go find your cell phone wherever it is. If it's in the other room, right? Then pick up your cell phone, call 911, put your cell phone on speaker, okay? And then continue CPR, okay? So let's put them back down and let's continue one more set of CPR. Ready? And let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 23, 24, 25, 16, 17, 18, 9, 30. Head to chin lift. 1 puff and 2 puff. Excellent. Give yourselves a round of applause, class. Okay. Now, the last thing we want to do, you can have a seat, is we are going to do a last minute review, okay? What are those 3 organs that we're going to coincide with the easy way to remember the meaning of CPR? Anybody?
Heart, lungs, and brain.
Heart, lungs, and brain. Can we all say that together? Heart, lungs, and brain. Absolutely. Now, what does the heart deal with?
Transports blood.
Blood, right? Good. Excellent. And what does the lungs deal with? Bring in that oxygen. And those 2 organs work very closely together to produce what? Oxygenated blood, okay? That oxygenated blood is what allows the brain to work, okay? So what allows the brain to work? Oxygenated blood. It nourishes, revives, and sustains the brain, okay? And if the brain shuts off, we got to put that back in there to get it working again, right? Now, look, if you have a heart attack or you choke or you bleed excessively or you drown, whatever the case may be, if you impede oxygenated blood from going to your brain and your brain shuts off, you are considered what?
Dead.
Considered what? Dead, okay? Right? Clinically dead, right? If it had recently just happened, you're dead. But look, we have how long of a time to get started with CPR to bring you back to life? 10 minutes, right? Otherwise, you will go completely what? Brain dead after 10 minutes of no CPR, which is the action or process of flowing oxygenated blood to your brain to sustain your brain with not occurring further brain damage and actually to try to revive your brain, okay? Every second, there's an increasing level of brain damage every second that we're not doing CPR, there's an increasing level of brain damage, okay? When do we do CPR? When they're dead, okay? Good, when they're dead. How do we know if they're dead? Unresponsive, no breathing, no pulse. Let's all say it together. Excellent, okay? Now, how many compressions, how many breaths are we going to do? 32. Good, excellent. And 2 hands for adult, 1 hand for children, 2 fingers for infant, okay? All right, so that's going to conclude the class for today, class. We really appreciate it. I'm going to hand you out your cards. Just one last thing, because we kind of did get into it. High blood pressure, diabetes, right? That's going to lead to the heart disease, which is the #1 cause of death, right? I know COVID is a factor, but a lot of times, man, people are dying from the COVID because of the pre-existing conditions from these other things. So let's take care of our bodies, build our immune system, and then we'll be strong enough for that COVID, okay? All right, thanks a lot. Give yourself a round of applause. Good job. Okay, I'm going to hand those cards out. Let me start my little video.